Okay, so we're late. Big surprise here today. I'd like to apologize for that, but it's inevitable in a medical practice. It's not like an assembly line. So let's go ahead and get started. We've only got a few minutes, so we're going to talk about what we're going to talk about. There's a question about terminology here, and so we're going to try to clear that up, and then I'd like to ask you all a question and get some feedback on what you think about this subject, as well as give you a little taste of where we're going next. So, first of all, I want to make something clear, and that's a terminology issue, TCM, and we're going to say that that is equal to TOM, and we're also going to say that that's equal to TAM. Okay, so what does that mean? What that means is traditional Chinese medicine is the same as traditional Oriental medicine is the same as traditional Asian medicine. It looks like it's backwards. How about that? Okay, well, that's why we're here, is to figure out tech stuff. It depends on what vintage you are, if you will, how you refer to this medicine. Many people in China will consider it traditional Chinese medicine. Here in the States, the politically correct term, I believe right now, is traditional Asian medicine or traditional ASEAN medicine, if you want to be really up to date. And so here's a question for you. Those of you that are in the biz, what do you call what you do? And those of you that aren't in the biz, what do you think we should call it? Traditional Asian medicine is the way that I'm referring to it now, trying to be politically correct. Let me know what you think on that. The other thing that I wanted to mention today is that I think that traditional Asian medicine is really Asian philosophy and practice. So we're going to be talking a great deal about the philosophy behind traditional Asian medicine. I'd say also traditional Asian martial arts is Asian philosophy put into practice. So why have I referred to this as the original longevity medicine? Well, we've got about a 2,000-year period that just ended about 100 years ago, 1911 or so, when in China, for that period of time, for almost 2,000 years, it was ruled by emperors. And the emperors had an agenda. Now, they were about as colorful and diverse a group of people as you can possibly imagine, young to old, wise to foolish. Really, the history is incredible. And there were so many of them, but they all had a couple of things, I would say, in common. And I think that we still share these things in common. At least the people that walk into my practice certainly are looking primarily for a couple of things. One of them is more energy, better quality of energy, better quality to their life. And the other is a better sex life. And the emperors certainly had an interest in virility, longevity, and the fertility of their wives. And they called to them the finest physicians of the time. This created what could be referred to as a number of lineage traditions. These lineage traditions perpetuate to today, some of them. Some of them have been lost, I think, unfortunately. Some of them were handed down father to son, continue to be so in that way. Some of them got blended into what we now refer to as TCM, or TAM, in the time of Mao. Some pieces of it, I think, maybe got brought in. But TCM is really a structured way of approaching Chinese medicine. Very logical, very professionally oriented to both herbal and acupuncture medicine. Very strict and well-formulated diagnoses and treatments for those diagnoses. Almost protocol, although that's a word that we tend to shy away from in Asian medicine. TCM, when practiced properly, is a very rigorous, very logical system. That's about all I'm going to say about that. We're starting to run low on time. Once again, let me know what you think. What should we call this medicine? And why I've termed it the original longevity medicine. Didn't really go into that all that much. I'm sorry I'm pressed for time. Patients just take up more time than you think they they need to. Sometimes. In any event, we'll be back tomorrow. We'll continue the discussion. We'll start to go a little bit more into some pieces of philosophy. Thank you for your time. And please, let's make this a dialogue. I'm coming into these pretty much cold. No script, no nothing. So talk to me. Let me know what you think. Thanks. Bye.